Hello, today I'll be handling what you call the Parkinson's disease, and the learning objective are we are going to talk about the definition of this disease called the Parkinson's disease. We talk about this, its signs and symptoms. We also going to talk about the treatment, and finally the fourth objective is what you call the therapies involved or to be carried out with the patient presenting symptoms featuring the Parkinson's disease. Okay, definition. Parkinson's disease is a disease caused by degeneration of the dopaminergic neurons within the substantia nigra within the brain. So this disease comes about when the neurons are generating dopamine within the body or within the midbrain degenerates due to some reasons, either genetic, environmental stimuli, and other risk factors. Now, this is a brain condition which brings a lot of problems pertaining the health issues, the movement, gait, balance. It causes pain and very many other health issues. Now, what we do realize, what are some of the symptoms and signs that a patient will present when he or she comes to your clinic? Number one, you will see what you call the dyskinesia. Dyskinesia is a term used to refer to involuntary movements of the patient. We also have a slow movement pertaining how the patient moves. It appears to be slow. We also have tremors. Tremors are the movements, jerky movements of the patient. We also have trouble walking, and this patient looks like he's being punished by walking. And then we also have what you call imbalance. This patient fails to balance his or her own body. We also have what you call the pain. Sensory disturbances within the brain. We also have sleep disorders. Sleep disorders are insomnia. Insomnia is lack of sleep. You also have dementia, then also mental health disorders, and very many symptoms. Those are the main symptoms. So to summarize, we have the first one is dyskinesia. What did I say? This the definition of dyskinesia. Dyskinesia is the involuntary movements of the body, tremors, pain, and those other symptoms. When a patient comes to your clinic and presenting those symptoms, keep in mind that it might be Parkinson's disease. I'm not saying it's Parkinson's disease, but it might be Parkinson's disease. Now, we move to the third thing, that is the treatment modalities. What are some of the medicine used to treat a patient presenting with those symptoms? Number one, we have a medicine called before telling you the name of this medicine, what comes to your mind when we talk about treatment? Treatment is just managing that disease. So if this Parkinson's disease was caused by degeneration of the dopaminergic neurons or the dopamine generating neurons, so the medicine will focus on how will it return the dopamine within the brain. So a medicine called Levodopa, or what you call the carbidopa. What does this medicine do? This medicine combines it is a combination medicine that increases the amount of dopamine within the midbrain, within what you call the substantia nigra within the midbrain. Substantia nigra houses these neurons containing dopamine. So what is the function of this medicine? This medicine increases the generation of this dopamine into the neurons within this part of the brain called substantia nigra, housing them. Also, we have what you call the anticholinergics. Anticholinergics is just used to reduce the involuntary muscle movement. That is what you call dyskinesia. Other people say that there is no cure, but therapies and the medicines can reduce the symptoms. There is no complete cure. This medicine just reduces these symptoms. Yeah, so it subsides these symptoms and signs of Parkinson's disease. The final thing, therapies. What are some of the therapies that you will conduct on your patient when he or she comes to your clinic presenting the symptoms which you have concluded that it might be Parkinson's disease? Number one, you do what you call the strength training. Training. Then also, how can you conduct strength training? You just train the muscles to move in one direction, in other direction, like that. We also have what you call the gait and the balance training. How will you conduct this? Immediately when the patient walks to you, you can realize how he or she moves to you. That is what you call the gait. Gait, you can just tell the patient to move a meters from you towards that point and come back to you, and see if there are some jerky movements of the patient, or the patient feel like he is not comfortable walking, or she, then realize that you should do what you call the gait and balance training. Then we also have what you call the hydrotherapy. Hydrotherapy involves the therapy is used conducted by application of water. Okay, that summarizes everything about the Parkinson's disease. So Parkinson's disease is just degeneration caused by degeneration of dopamine generating neurons, or what you call the dopaminergic neurons, within the substantia nigra of the brain. Okay, that is all about the Parkinson's disease. In my next video, I will talk about what you call the cerebral palsy, and we continue like that. Okay, subscribe to my channel, please. Thank you. Let's meet in the next video.